Bore da a croeso. This is my 2 years of Duolingo. It's going to get better over time, I'm sure. Good morning and a very warm welcome to everyone. It's a great privilege for me and also very meaningful to me to be here today and lead the launch of the Women's Health Research Wales infrastructure. As you know, this is a 5-year investment from the Welsh Government via Health and Care Research Wales, and it's to catalyze effort into women's health research and innovation, which, as you'll see and hear, was sorely underinvested for a long time. So the first thing that I'd like to do is to give immense thanks to all the co-applicants of the center and to say that everyone has worked together pan-Wales for the center. So to begin with, I'd like to invite the Professor Wendy Lorner, President and Vice Chancellor of Cardiff University, to give the welcome address.
Well, bore da and croeso pawb. It's just so lovely to see everyone here this morning, and what a lovely event to be celebrating in the lead up to holidays. A real joyous feel in the room this morning, and I feel very privileged and happy to be part of this launch event for Women's Health Research Wales. It's a huge milestone. Not just for the wonderful team whose faces we've just seen on the screen, not just for Cardiff University, but we are incredibly proud to be hosting this initiative, but actually for Wales as a whole. You all know this is way more than just a research centre. This is a commitment to equity, innovation, meaningful impact, an initiative that will address long-standing health inequalities in Wales and advance research that truly matters. People may know I've been in this role for just over 2 years now. One of the things we've been talking about very clearly during that 2 years is how this university can really play a leadership role in Wales, not just being in Wales, but of Wales, really making a difference to the economy, the society, to culture, and this initiative absolutely exemplifies the kind of work that we want to be part of as a university, not just with our peer universities, but with all the partner organisations who are also part of this initiative. Collaboration is at the heart of the Women's Health Research Wales initiative. Collaboration is what we want to be at the heart of as a university, because it's only through this kind of collaboration that we'll really make the difference that we all want to make. Again, not just for our university, not just for Cardiff, but for Wales more generally, really lifting the position of Wales on both the national and the international stage. You know that Women's Health Research Wales builds on the exceptional strengths of Welsh universities in health, in life sciences, and actually in interdisciplinary research. And again, in that context, it's lovely to see colleagues from a whole raft of different areas coming together this morning to really ensure that improving women's health is treated as a strategic priority. Now, as I've already said, this initiative extends far beyond academia. There's collaboration with the Welsh Government, with Health and Care Research Wales, with NHS Wales, with industry, with the third sector, with the public. Again, these are exactly the kinds of partnership that will drive the innovation and real-world impact we all want to see. And it's by doing this that we're going to put Wales on the international stage. There are extraordinary things that happen in this country that deserve to be much better known globally. And the work we do in women's health research is one of those areas. So on one hand, what this will do is amplify the visibility of the work that we'll do. But on the other hand, what it will also do is ensure the benefits of this work reach the communities that need it most. Jackie and I were just talking about our explorations in rural Wales, women in communities who are a long way away from centres of health excellence like those we have here in Cardiff. How do we ensure those communities, women and people who are assigned female at birth, as well as the role that we all know that women play at the heart of their families, community groups, workplaces, schools, the NHS, where women make up the majority of the workforce. So such an important initiative, an initiative that will shape policy, that will improve care, and importantly, inspire future generations. So as the Vice-Chancellor, I am deeply proud that we are hosting Women's Health Research Wales. I am very clear about our commitment as a university to supporting the success of this initiative, not just for the next 5 years, but for the work that will then go on and we will build on following that. I do want to say diolch yn fawr to all those involved, to the Centre's leadership, the researchers, the public contributors, the partner organisations. We couldn't do this without you. So this morning, so much more than just a launch, but it is a wonderful launch. It's the beginning of a new chapter for women's health research in Wales, and I'm hugely privileged to be here to acknowledge that, to celebrate that, and to look forward to a wonderful, successful journey from here on in. So thank you so much for coming this morning, for joining with us. And again, a bit like Jackie, because I'm practising my Welsh, Nadolig Llawen.
Thank you very much, Wendy, for sort of a resounding support for Women's Health Research Wales. In the next few minutes, I'd like to tell you all a little bit more about this research infrastructure. And I've been told 8 minutes and no more, so I might have to gun it in some areas, but I won't skimp on this. This is the vision. Our vision is to eliminate inequalities in the health and well-being of girls, women, and people assigned female birth. We're here to support patients, communities, industry, policymakers, and practitioners realize their goals in achieving this shared vision. Now, you might say, why are you focusing on women's health? It's a question we get a lot. This is because we're eliminating inequalities that are rooted in the everyday experience of women in Wales. Really, the odds ratios are stacked against women. So imagine that you've got a street in Wales where Rydian and Anna live. They both have type 1 diabetes. They both have a similar background. Well, what's the outcome for the two of them? The disadvantage they have is that as a result of her type 1 diabetes, Anna has a 200% higher chance of having a fatal or non-fatal heart attack. She has a 150% higher chance of stroke. She has a 160% higher chance of getting kidney disease and dying from that kidney disease. She's got a 180% higher chance of getting abnormal tests that are not diagnosed. And as a result of that, not getting the care that she needs. She's going to slide into poverty and is likely to not be monitored appropriately. So really, for Anna, it's not looking good. And so we need to ask ourselves, how did we get there? And the reality is that there have been persistent failings and major obstacles in women's health. And these have to do with an underinvestment in women's health research, where women are not studied as people, the conditions that affect them uniquely, but the conditions where they are disproportionately represented, and also where they have different manifestation of these diseases. And these persistent failings knock on because that means that women are underrepresented in the research that matters to policy. So they're not in clinical trials because they have the menopause, because they're pregnant, because they have periods, et cetera, that might screw up the trial. Also because they're not in those things, they're not in the synthesis evaluations, and they're not in the meta-analyses and so on. And therefore, their views, their dosages, their experiences are never in the guidelines that determine practice. And there's also, for women, persistent and overlapping systems of inequality. And that is, for example, in work poverty. Women, for a variety of reasons, have jobs that don't pay well. Well, that is something to add to these kinds of burdens I've just spoken to you. But importantly, women's health and women's health research has always been secondary in research centers. That it's never been the primary focus and the purpose and the vision of the research center. Well, fortunately for us, that's all changed. Because right now, women's voices are at the center of this infrastructure. And in this infrastructure, we have objectives, and we're already making progress towards those objectives. And you can see these here. We're going to create research. We're going to work with our partners in industry to develop innovation and devices that work for women, prostheses that work for women, variety of other things that women use that are made not for women but for everybody else, the men especially, of course. We are going to facilitate long-lasting cycles of co-production and priority setting in women's health. We're going to make sure that we disaggregate data when we do research, that we look at sex and we look at gender, and we make sure that we understand where there are commonalities and where there are differences. And importantly, through the universities that are all pan-Wales, we're going to create a thriving workforce of people who are experts in women's health. And I'm not just talking researchers here. I'm talking also practitioners, policymakers, public partners, and so on. Now, we have priority themes, and these are the priority themes, and they're based in the Discovery Report, which is the voice of more than 4,000 women, that also informed the Women's Health Plan, which we'll hear about from Helen Monroe in a minute. But what we're trying to do is, women's health has traditionally been about reproductive health, and it's important for us to continue in those areas, but we also have to broaden that conceptualization of women's health. And through these thematic areas, we're going to do just that. We're going to go into autoimmune disorders and keloid scarring and all kinds of other things that affect women. We're going to look at all these transition spaces that women have, from adolescent to adult, from parental care to self-management. We're going to look at how to prevent appropriately for women. We're going to look at the rare and stigmatized conditions that women have that no one talks about, because it's like urogynecology, or it's going to be something else that's just stigmatized we shouldn't talk about. And we're especially going to talk about underserved communities. And Wendy mentioned rural health, but we're also going to look at women in precarious housing, women in prisons, and so on, for which we almost have no information. Finally, you might think, oh, well, this is all good and well, but this is going to cost money. Well, actually, the investment, a pound investment in women's health, just in obstetrics and gynecology, returns a £10.90 or almost £11 return on investment. And this is just for one tiny area of women's health. Imagine what the numbers can be if we actually start looking throughout women's health. And this is research in England, but we're doing the research here also in Wales. So I'm very briefly now going to say something about the progress since April, because of course there's the foyer and we can do more of that later. But already since April, we've already had 5 grants awarded, over 1.5 million. There's 5 under embargo that's going to push that number well above 2 million. We also have 12 grants under review. Hopefully we get some of those. So building the research portfolio, creating that capacity among researchers, we're working on that. We also have done quite a lot of engagement activities already. We've engaged with our stakeholders. Helen Munro's team, we work very closely with her and her team, and Sam is here as well somewhere. We've worked with schools and industry. We've worked with communities and training. We've done lots of different events, and you'll hear more about them later. And all of this is to stimulate that drive and innovation and energy and excitement about working in women's health. We've also strengthened our partnership. Of course, we had Pan Wales when we started, but we're increasing the number of universities that we're partnering with. We're expanding our partners, but importantly, we also have global partners like the WHO, the World Health Organization, which we participated in the prevention programs for infertility, for example. We have a lot of industry that we're bringing into Wales to talk about women's health. And we have some exciting projects that you'll hear about outside. As my final slide, I just want to say that for me, this isn't just about the research. It's also about coming full circle. This is a picture of me and one of my first PhD students, almost quite a long time ago. I started 30 years ago, and it's, in those early days. Her name is Laura Bunting. And I came to work with her after 20 years, went back to working with her in the sense that she was in Healthcare Research Wales, and she participated in the development of this, or the conceptualization of this call. Unfortunately, she had to step down because of illness and cancer, but, I want to remember her now. And what I want to say about this is that in a small country like Wales, we're always going to have touch points. People interested in the same research are always going to bump into each other. But to tackle the big challenges like inequalities in women's health, what you really need is infrastructure funding that's going to be able to bring people together, that's going to be able to inspire people and make sure we're all working to this common vision. And for that, you need political will. You need people who are committed to seeing that, and which is why it gives me immense pleasure to introduce the First Minister, Elena Morgan, and also Sarah Murphy, the Minister for Minister for Mental Health and Wellbeing with responsibilities for women's health. They have been absolute champions of women's health, and they have put, if you will, the political might behind the work that we've been doing. And it's only because this political will was sustained that we were able to get the funding for this infrastructure. So please welcome First Minister.
We did it! Da iawn! Da iawn chi, llongyfarchiadau mawr I chi, and let's be clear, none of this could have been done without that partnership working that we've all been so keen to develop in Wales. Mae'n bleser mawr I fod yma gyda chi y bore yma, a diolch am y gwahoddiad I lansio ymchwil iechyd menywod Cymru. It's a real pleasure to be with you this morning to launch this Women's Health Research Wales Centre. Today does feel like a landmark moment. It feels like something has shifted. And I am extremely grateful to you for that, because this isn't just the launch of a new centre. I think this is a statement. This is a statement about the kind of health system that we want in Wales. One that works for everyone. And the fact is that women didn't feel like it was working for them. I have met countless women who tell me I'm not listened to. They don't hear me. I tell them there's a problem. They're not taking me seriously. And it's no wonder if the research is not there to tell medics that actually the research isn't in the right place. And that's why this is absolutely critical. So I am very pleased that we're going to shift the agenda onto one that's grounded in fairness and in health equity. And this is something I care very personally deeply about, because when I was health minister, I did listen to women across Wales, and they did say to me, it's very fascinating, you know, women talk to women in a different way from the way they talk to men. That is the truth of it. You know, when I went on my listening exercise around Wales, I don't think they'd have gone up to Mark Drakeford and said, you know what, I think I've got a little problem with women's health. I don't think they'd have done it. But they were keen to tell me. And I felt it was my responsibility then, particularly as a woman leader, to say this has got to change, this has got to shift. And for me, this is a flagship of my leadership. And I'm so pleased that Sarah Murphy, was committed to this way before I appointed her as Minister responsible for women's health. She's always been a champion of women's health. So she was absolutely the right person to drive this forward. Those conversations that I had with women around Wales, they stayed with me, and they're a big part of why I'm absolutely determined that this work has got to be pushed forward to make sure that what we have here is women's health treated as a priority, not as an afterthought. It can't be something bolted on. It's got to be right at the beginning to address those inequality issues. This is life-changing and life-saving if we get it right. And that's why we, in the Welsh Government, have backed this centre with funding. And it was fascinating to have those conversations with people in Welsh Government about research and where it was allocated. They said, it's all been allocated. It's all been allocated. There's no more. And you just think, I'm the leader of the country. If I say you've got to shift it, bloody well shift it. And it was that kind of determination that you need. You do need to go up against the system that has been locked in against this kind of research in the past. So that seed funding that the Welsh Government has put in, it's not a small amount, 700,000 is not a small amount, but it has leveraged in the rest of the funding. So I think that's absolutely right. It's the commitment of the Welsh Government, not just for a research centre here. This is an all Wales approach, right? This has got to be something that helps all the women in Wales. I'm so pleased to see that partnership across the whole of Wales, because it matters. It matters to people across the whole of this nation. But you do need centres of excellence. You need people to cross-fertilise ideas, to work together, to feed off each other. But there's no reason why that shouldn't be done across the whole of Wales. So I want to thank, in particular, Dee and Debbie in the Fair Treatment for Women of Wales for all that they've done to drive this agenda forward. Now, it makes a difference, and you've been doing this for years, way before I came on the scene. You've been, and I hope you're pleased with the progress that's been made. It was great, actually, because I remember promising someone, we are going to have a women's health plan. We are. I'm going to make it happen. And it was great that we all celebrated about a year ago on the steps of the Senedd with a bit of Prosecco saying we've done it. We've done it. And how appropriate is it now, a year on, for us to start really driving this forward? And for me, what's important is that it's not all about gynecology, right? I think that's really important. That was one of the big lessons for me when I was health minister. It's not all about gynecology. There's a whole load of other inequalities that are going on here that we're missing. So that, for me, is crucial. So there's a whole load of things going on, but my God, the breadth of this, this could be a very significant piece of work that could be transformative, not just for women in Wales, but actually globally. And that's certainly where I want to see it. I think this centre puts women's research where it belongs, at the heart of research policy and care, and I think it aligns with our wider ambitions around prevention, around innovation, around social justice, and it plays that vital role in delivering the Women's Health Plan for Wales. And before May, we will have health hubs all around Wales where those centres will be established, where women can have that degree of expertise. And whilst we're here at Cardiff University, as I say, this is a national endeavour. That collaboration across Wales, bringing researchers together, I think that's key. We need to make sure that, you know, some of the research is being done across the nation. What an opportunity. We're 3 million people, right? We've got one health service. We can do this better than anywhere else because we're one health service, right? I mean, you try and do that in England. It's totally fragmented. You can't have that all Wales approach. So what an opportunity for us to really take a lead. I know shortly we're going to hear from Debbie about the importance of co-production and the public voice, and I do think that that is critical. People have got to feel a sense of ownership of this. And it's got to reflect real lives, real experiences, if it's going to lead to real change. That's how we build trust and deliver for women. So I want to thank Cardiff University for hosting today's launch, and to Professor Wendy Lana, the Vice-Chancellor, diolch yn fawr I chi am cynnal ni heddiw hefyd. And also, I want to thank in particular Professor Jackie Boivin. Merci beaucoup. How about that? De rien. But thank you very much, because I know you've got a team of women here who are absolute leaders in their field, but they will become global leaders in their field. Are you hearing me? Yeah. That's where my ambition is, okay? I want this to be a global leadership centre for women's health. Let's be ambitious, okay? This country, as Wendy was saying earlier, we hide our light under a bushel all the time. We do some great stuff here. We don't tell anyone. We've just hosted an investment summit. People couldn't believe what we got up to here because we don't tell anyone. It's time we started to stand up and be counted and understand that we are a very special people, that we've got a lot to be proud of, but we've got to start shouting about it. Enough of this Welsh shyness, okay? Let's get out there, especially us women, right? This is our age. This is our time. This is our time to step forward and to be proud and to say, no, we are leading. You're all leaders in this room, all of you. You wouldn't be sitting here otherwise. That's what we want to see. We want to see leadership. We want to see this centre in particular leading the way for women across Wales. I was shown this lovely exhibition earlier, and I was asked about the quilt. And I remember attending an event, which was a marvellous event in the Every Woman Festival, and thank you for organising that. It was absolutely remarkable. But I was asked to sew. I can't sew to save my life, is the truth of it, right? So they did ask me, can you write something on there to do with women's health? And actually, I was thinking about my mother, and she was suffering with incontinence, right? She was so ashamed and so embarrassed and didn't want to tell anyone. And she thought she was the only person in the world who was living with this. And, you know, around 50% of women have incontinence. But nobody talks about it. She was so ashamed, didn't want to talk about it. And I just thought, we've got to talk about these things. We've got to get them out in the open. We've done it with menopause now. We're on the road with that one, aren't we? We're kind of, right, let's talk about menopause all the time. We've got to start talking about incontinence. You know, there are a whole load of other things that we've got to talk about. So I started weaving or sewing or whatever you do with those things. I don't even know the words to use. Incontinence. But I thought it would take me about 4 years to do that. So I finished up writing we, which is not very... It's not very first ministerial, is it, if we're honest? But I think this is a great gesture, and you know that's the point, isn't it? Let's start being honest. Let's start being honest about what women in our communities are facing. Let's start talking about the barriers that women are facing and the hurdles that we've all got to get over, and the opportunities to fix what is a problem that has been there for many, many decades. This centre is an opportunity to change that. It's an opportunity to look to the future with hope for all the women in our communities across Wales. So diolch yn fawr iawn i chi. Thank you very much, and I do hope that this centre goes from strength to strength. Diolch yn fawr iawn.
Thank you very much, First Minister, for continued political energy, but also for inspiring words and for that wonderful anecdote that I'm sure everyone can, think to their things that they're ashamed about or embarrassed about, or, you're right. We just need to go forward now and just address all of the topics in women's health. And great that we're already making work on menopause. So I would now like to introduce Dr. Helen Monroe, who is the clinical lead for the National Clinical Strategic Network for Women's Health. She's a close collaborator of the Centre, and I'm immensely pleased that you were able to be with us today.
Thank you. It's a huge honour to join Professor Boivin and her team this morning in opening the Women's Health Research Centre for Wales. A milestone moment, should we say, for women's health in our nation. This event provides the perfect opportunity to reflect on the progress of the network and to show how the Women's Health Plan has been implemented over this last year. The National Strategic Network for Women's Health is one of 12 networks which sits within NHS Performance and Improvement. Leading the work, we have a clear mission: to advance the quality, safety and equity of women's healthcare across Wales. At the heart of this mission is a bold ambition: to close the gender health gap. Our approach is built on 3 pillars: prevention, workforce development, and digital accessibility. Together, these pillars ensure that women across Wales can access improved services and experience better health outcomes. The Women's Health Plan launched in December 2024. Indeed, we all met on the steps of the Senedd, and it's unique. Unlike other strategies, it is a plan that's been written by the NHS for the people of Wales. It sets out a 10-year vision because meaningful, lasting change takes time. Yet we know that women have already waited too long with systems and processes and treatments that were never designed for them. They have waited too long to be heard, seen and believed. The plan is about changing that reality. Our vision for the next decade is clear. Women will have better access to health services and trusted information, with a strong focus on prevention and reducing inequalities. Our workforce will be skilled and equipped to deliver care across diverse settings. Health boards will prioritise women's voices in designing those services, and data will be disaggregated by sex and gender, driving research and innovation to improve outcomes. Now, I'm sure that everyone here has read the plan and knows it as well as I do, but if not, here's your opportunity. We had 36 individual lead authors who gave us their time and expertise. We had an additional 65 colleagues who shaped, refined and formed the plan so that it was ready for publication this time last year. So how are we doing with implementing across 8 priority areas and 64 actions? Progress in year 1 has been strong. All short-term actions are planned and in progress. Most medium-term actions are also underway, and even some long-term actions have begun. Momentum is building, and these are some highlights. Women's health hubs represent a new way of organising care. These hubs are not single buildings, but a coordinated approach by health boards to make care accessible at every stage of life. supported by local needs assessments and co-produced with local service users. Pathfinder hubs will initially focus on care associated with menstrual health, contraception and menopause, but with a view to extending this into March 2026 and beyond. We have also launched bilingual, youth-friendly learning materials for schools, co-produced with young people, school nurses and educational partners. These resources include discrete posters, QR-coded cards and leaflets covering menstrual health, endometriosis, pelvic health and menopause. The official launch in December marked a significant step to empowering young people with accessible, evidence-based information. Digital innovation has also been a priority. The Bloody Brilliant website for menstrual health has been refreshed with a new design and interactive features, while the Period Dignity Map now has its own microsite, making it easier to find free period products around Wales. We are tackling issues like unplanned pregnancies. Did you know that 45% of pregnancies are unplanned or ambivalent? Our contribution to a national report calls for integrated postpartum contraception in maternity care, ensuring accessible, equitable access. Improving and understanding conditions such like endometriosis and adenomyosis is essential for timely diagnosis and better care. To support this and in collaboration with the network, we've worked with HEIW in developing a new learning module for NHS Wales staff, available via the platform Irti Dysgu. The educational resources will also include e-modules around culturally competent consultation skills, contraception and menopause care. And we've partnered with the Diabetes Network to create information for young people about contraception choices and how they may interact with the medications they take. We're helping to drive those priorities in research and innovation through these close ties with the Women's Health Research Centre and initiatives like the Small Business Research Initiative funded through Welsh Government on the Women's Health Challenge, which supports companies developing technologies for faster diagnosis and better treatments. Looking ahead, the NHS Wales Women's Health website will launch in early 2026. A trusted bilingual resource shaped through co-production, it will provide clear, reliable information across life stages, helping women make informed decisions about their health. And finally, we are amplifying women's voices through creative projects like Chronic Women, a poetry initiative led by Literature Wales. The project invites women living with chronic illness to share their stories, which will culminate in a bilingual anthology distributed to GP surgeries and healthcare settings around Wales. Wales has a unique opportunity to improve the health of the 51% of the population. We need to protect and value the health systems which put the person at the centre. Inclusivity is at the heart of the plan, with a commitment to see active engagement with diverse populations and ensuring that all women's voices are heard and involved in shaping our own health services. Collaboration has been at the heart of the Women's Health Network over these last 12 months of implementation, and we are committed to this approach into 2026 and beyond. Together, we can commit to building a future where every woman in Wales has access to safe, equitable, and high-quality healthcare. Thank you.
Diolch, Helen. Thank you so much for such awesome leadership. I mean, I've had the pleasure of working in many groups and advisory and committees and seeing this progress. And honestly, it's like a bulldozer. I mean, really quite impressive. And now it gives me great pleasure to introduce my longtime collaborator, Debbie Schaefer from Fair Treatment for the Women of Wales, who is a partner in the Women's Health Research Wales, and who is a driving force for all matters of patient public voices. And she's our last speaker. Thank you.
Thank you so much for the invitation to speak today at this hugely exciting time for research in Wales. And I say research in the broadest sense because a focus on the health of women and people assigned female at birth holistically and across the life course will benefit each and every one of us, our families, education, workplaces, healthcare, the economy, and of course, women themselves. There is a huge amount of evidence to show that our needs haven't always been met when it comes to our health and well-being, including menstruation, maternity and menopause, yes. But actually across almost all aspects of health and throughout our lives. This is why we're so delighted that Wales now has both a women's health plan and a research centre to make a real and positive difference to our lives and those of future generations in Wales and beyond. FTWW's role within Women's Health Research Wales will be to provide patient perspectives on everything the centre does, from the way it's structured to the way it communicates, its strategic priorities, and how it involves public partners, underserved groups, and seldom heard voices in its activities. But our involvement in this space started way before today, because it's through research that we've learned about our community's experiences in order to advocate for their needs. For us, and the wide and varied members of the Third Sector Coalition we chair, when it comes to women's health, there are common themes that emerge, no matter what the symptoms or treatment or the clinical specialties in which conditions sit, including long diagnostic delays, interventions that don't always work for us, or services that haven't always met our requirements. The aim of Women's Health Research Wales, therefore, is to address these issues, prioritising our need to be heard, understood, and taken seriously. We're proud to say that the principle of listening to and valuing patient expertise is at the centre's heart, because even the application process fully involved us, involved patients, from inception through now to delivery. And it was clear from the start that building Women's Health Research Wales around collaboration would be vital, not as something just to tick off in the engagement box, but because it makes sense, both for individual contributors and if we're to be sure that research has real-world impact. We recognise that for many women, being enabled to participate in research grows confidence. It provides a sense of purpose. It can give meaning to the health-related challenges that they've encountered. None of us want to see research studies sitting on a shelf gathering dust. We want them to make a meaningful and positive contribution to our lives. This is why we're so delighted to see a commitment to public and patient involvement throughout the centre's activities and ethos. Colleagues in Women's Health Research Wales recognise that patients are experts by experience just as much as clinicians and academics are experts in their own fields, with, of course, the potential for much crossover between all of us. This collective approach is one we often describe as co-production, and it's one that's always been part of the NHS mission. It can be seen in the first principle of prudent healthcare, and in Welsh legislation such as the Social Services and Wellbeing Act and the Future Generations Act. Co-production ensures that citizens' voices are at the heart of things, with people working together as equitable partners, finding out what the gaps are, understanding inequities, sharing ideas and coming up with solutions together, the very definition of research and the core purpose of Women's Health Research Wales. It's for this reason that we're so pleased to be the centre's public and patient involvement and engagement co-leads, helping to ensure that the work undertaken is rooted in what matters to Wales's population and that diverse voices are heard. We look forward to helping ensure findings translate into practice, that partnerships are sustained so that research remains relevant. Above all, we look forward to seeing Women's Health Research Wales realise its ambition to improve all of our health and lives. An exciting time indeed. Thank you very much for listening. I hope you have a great rest of the event.
Thanks so much, Debbie. As always, you remind us all the priority that women's voice is always at the center of everything. So the next step in the agenda is really to invite you to view some of this artwork here and to participate in the walkabout. So this artwork are various artists in Wales and depictions of women. It's used just basically to say we're all different, all kinds of different women. But it's also to say that I also have an anecdote for the quilt here, the Every Woman quilt, which is, if you look here, Womex. When we submitted the application for funding, our name was Womex, and we submitted the application, and I stitched it into the quilt for good luck. And Healthcare Research Wales said, you know, we're giving you the money, we love it, great concept, but we hate the name. And so Sarah Murphy, who has been such an inspiration and committed to this cause, has now stitched the first W, and we have permission to write the full name now, the Women's Health Research Wales. So if people want to stitch a letter, you're welcome to do that. I think it's beautiful. Second, yeah. I mean, the we is obviously the key. It's perfect. So we also have a walkabout with Eluned Morgan, First Minister, if there's time still, just to walk around the posters. You're all welcome to do that. Of course, the Sarah Murphy and Eluned Morgan will have to go off to their other activities and the media at some point, but you're all welcome to stay until 1. There's also a lunch, so you can enjoy the vegan prawns that Cardiff University has on offer. And just an immense thanks to all of you for coming today to participate in the launch. It's made the day for us, and we hope you enjoy the rest of it. Thank you very much.